Public health stakeholders have called on the federal government to harness the power of science to improve public health in the country. This was made known during the fourth biannual stakeholders engagement meeting in Abuja, where they called for collaboration to improve the nation's health sector.
We're gathered as stakeholders in the health sector. The meeting is being facilitated by the CDC, Center for Disease Control Nigeria, and of course sponsored by the US government and its agencies, PEPFAR, US, UNAIDS, and so many other partners. So we're here to discuss and to brainstorm on the science, involving the health sector, because we need to get the data right, to get the science right, to be able to respond adequately to the needs of our people.
The health coordinating minister has set a renewal investment program with very clear expectations on what health outcomes we're all looking to. And the development partners, including US CDC, have now rallied behind the government to achieve those health outcomes with a set of activities that we agree to partner in. And to be very honest, given my experience in working in other parts of Africa and the world, that is the recipe for success. So I think Nigeria is poised to really see change in things that are important to people. So reducing child mortality, reducing maternal mortality through immunization, through identifying infectious diseases early so that they can be treated, through ensuring that we have every thing ready to prevent, detect, and respond to emerging threats that may be unexpected. So I think Nigeria is poised to do very well in the coming years. And if what we've all set off to accomplish is accomplished, that effect will be felt for generations. But the key to accomplishing health outcomes is at the community level. It is at the grassroots. And it involves communicating with people because, no matter what health outcomes we want to achieve, it's going to need the community to take it up, right? You can decide to go out and vaccinate, but it's up to the individual to accept your advice to vaccinate. So right now, one of the very important partnerships that we have is in health promotion. So ensuring that we're working with yourselves as partners to communicate to people what exactly we're trying to accomplish and why it benefits them and their children.
A key thing is funding. And any program that lacks funding will not be eventually this. Then the political will from your principals. The governors taking responsibility. Now political will to take up this responsibility. Number two, attrition, human resource for health that is quite daring. Whatever you want to implement at the subnational and local government, you need a human resource. And when they are moving out or they are not available in numbers that is required to cover these places, it becomes a challenge. But it's not unsurmountable. We are working hard to see that these gaps are filled up and we're able to, at the end of the day, conclude by getting to our targets.